Hey guys, I said Fleming at Shepherd Insurance Partners wanted to bring a video to you about the Families First Coronavirus Response Act, or FFCRA. It was passed last week that goes into effect on April 2nd or by April 2nd, but it is encouraged to be effective now for employers. There's two parts that I want to cover today, and then we'll come back tomorrow covering a piece about telemedicine. For now, I want to talk to you about screening and actual treatment of COVID-19. All health plans are being updated to provide free screening for COVID-19. So if you feel that you're experiencing symptoms, please go get yourself tested. Your health plan will cover the screening. Now, the actual treatment, unless your health plan is amended to provide that for free, the actual treatment for COVID-19 is going to be subject to your plan benefits. So that could be deductibles, that could be co-pays, that could be co-insurance. Just depends on how your plan is set up. Now, it does not matter if you have a high deductible health plan with an HSA. You will not lose eligibility for HSA if you receive free screening for COVID-19. Again, the actual treatment for the disease is subject to your plan benefits unless the carrier has amended that. Next thing we want to get into are the paid days off, the expansion of FMLA. We have an expansion of providing 12 weeks of unpaid leave for any employer less than 500 employees and some public employers. Now, employers with less than 50 employees who can say that this would somehow cause my business to be shut down, they may be excluded from these regulations, but right now it's less than 500 employees for the private side and some public employers. You can also receive 2 weeks full pay sick leave if you're ordered for a quarantine or experiencing COVID-19 symptoms or seeking a medical diagnosis. Your employer cannot require you to utilize your PTO beforehand. Your employer can also not require you to find a replacement for your job. On the flip side of things, as soon as you are able to go back to work, it is your responsibility to go back. So if you are seeking a medical diagnosis and it comes back as negative, it is your responsibility to return back to work immediately. You can also receive 2/3 of your pay if you are caring for a quarantined individual or have to care for a child whose school or daycare is closed due to COVID-19 or due to a state order to close that facility. There is an additional 10 weeks of pay, also at 2/3 of your pay, if you've been employed for at least 30 days at your employer, if your employer has less than 500 employees, and you are not a public employee. Again, it is some public employees that can receive this, but most public employees actually have coverage for situations like this and other portions of their collective bargaining. And this additional 10 weeks are for if you are caring for a child because their school or their childcare center is closed for reasons related to COVID-19. Of course, tomorrow, all childcare facilities in the state of Ohio have to be shuttered. So it's really going to apply to a lot of people here in this state. Now, if your employer has taken your position and said it's okay for you to telecommute and will work with you and your family, and there's a chance that this won't apply to you, won't need this. But if your position is such that you cannot telecommute, you do have the expansion of family medical leave while also new paid leave. Employers do have tax credits available to them equal to the amount that they're paying out. So this shouldn't be too much of a burden. However, the smaller employers may find that it just is, so they may have an exception to this. That is kind of the really quick hitter on this one. We have a lot of information coming out pretty quick. We're just trying to make sure we get this out as fast as possible to everybody. If you have any questions, please give us a call, 614-259-5000. As you can see, I am also working from home, getting to enjoy a little extra time with the family. Hopefully everybody else is as well. We will put up a subsequent video that gives you what the calculation of your pay is, because it's just a little bit different than what you might expect. And then we will also dive into telemedicine. Telemedicine can be a good option to avoid going to the doctor right now. However, there are some considerations for both employees and employers, so we'll cover that in our next couple of videos. Thanks, guys. As always, everybody stay safe. Hope you're enjoying some extra time with your families as we get through this. Thank you.